Well, good morning or good afternoon, depending on where you are. We think the majority of you are here with us in California, and we welcome you to today's PowerPoint presentation and webinar called California Maternal Mental Health Laws. And we're providing today an overview of resources for both providers and hospitals, as well as an overview of the bill package that passed last year and one of the bills that is going through the legislature this year. Before we get started, I wanted to go through a couple of housekeeping items and then we'll introduce ourselves. We wanted to let you know that you're welcome to ask questions today using the question feature of your GoToWebinar control panel. It usually shows up for folks on the right-hand side of their screen. It's a rectangular box, a long rectangular on the right-hand side of your screen. So you can ask questions throughout today's webinar. I'm going to pause and make sure everyone can see my screen. Crystal, looks like you can see my screen.
Yes, I can see your screen.
Great. We're going to go ahead and ask who's on the line today. We're going to start by asking if you are, we're going to ask you to use your raise your hand feature. And
so Joy, we've actually got a couple people who can't see your screen, so we're going to have to.
We'll go ahead and ask you to go through these questions while we do a quick troubleshoot on that. So we're going to ask you to please raise your hand if you are a clinician. If you're a clinician, use the raise your hand feature. And Crystal, about how many people have raised their hand indicating that they are a clinician?
Looks like we have about 20 clinicians today.
Great. And let's ask those of you who work in a hospital setting, can you raise your hand? And Crystal, how many hospital staff do we have?
There's about 15 hospital staff here.
Great, we're glad you're with us. And then we're going to put everyone's hands down and ask who's with us today from an insurer setting, so a health plan or insurer. Crystal, how many do we have?
We have 8 representatives from Insurers.
Great, we're glad you're with us. And then let's put hands down, and we're going to ask for folks who are survivors or mothers who are interested in the California bill package to see if you might be on today. All right, Crystal, how many mothers do we have? Or family members of survivors?
It looks like we have about 11 people.
Okay, excellent. And I think in total we have about 80 people logged in today, and quite a few others who will be listening to the recording, we think. So welcome again. And we are having a slight bit of technical difficulty today. Crystal, are you sharing your screen in the PowerPoint? I think it's not up, right?
No, but there are some that can see your screen and some that cannot. So trying to address that right now.
All right, we're going to go ahead, and Crystal, I'm going to have you take control, and you're going to pull up your screen, and we're going to send the PowerPoint out retrospectively, and you'll have a chance to look at the PowerPoint later, since we're having trouble with that end of things. And we're going to walk through the resources that exist on our website. I think you'll find it's the same content. So Crystal, if you could please pull over controls and go to the 2020 Mom website.
There we are. Does that work?
Yes, we can see your screen. That's great. Thank you so much, Crystal. So we also, Crystal, are going to have you pull up the momswell.com or .org website. Thank you. So we wanted to first share that today's webinar is being brought to you by Momswell, a sponsor of today's webinar. We're going to give the Momswell leadership team an opportunity to talk a little bit about their product and the way that they can support all of you at the end of today's webinar. But again, wanted to acknowledge that Momswell is a sponsor for today. Thank you, Crystal. We'll go ahead and head back to the 2020 Mom website. So we wanted to share a little bit of background about both 2020 Mom and Maternal Mental Health Now, the two organizations that help sponsor the comprehensive bill package that was passed and signed into law last year. We're going to spend the majority of our time today talking about those bills, and also one bill that continues to go through the legislative session this year, a new bill. I want to make sure that you have an opportunity to learn about that as well. So I am going to ask Crystal to pause for just a minute here. I'm going to introduce myself. My name is Joy Burkhardt, and I am the founder and executive director of 2020 Mom. Our mission is to close gaps in maternal mental health care. We do that by focusing on the medical care system. So our belief at 2020 Mom is that if all of us are paying premiums to receive maternal and mental health care in the health delivery system, that system should provide the care that we're paying for. And we were focused here in California and also focused on solutioning on a national basis as well. So a little bit about us. I also now, Crystal, would love to have you go to maternalmentalhealthnow.org, and we're going to ask Kelly Kay, as you're going to that website, maternalmentalhealthnow.org, Kelly Kay, the executive director of this sister nonprofit, to say a quick hello and introduce themselves and their mission. So Kelly, we'll go ahead and turn it over to you to say hello.
Hi, good morning. My name is Kelly Kay. I'm the executive director of Maternal Mental Health Now. We're a Los Angeles-based nonprofit organization dedicated to removing the barriers to the identification, prevention, and treatment of perinatal mood and anxiety disorders. We were founded in 2007 by a woman named Kimberly Wong following her own experience with severe postpartum depression. And upon recovery, she reflected and she thought, if I had so much trouble finding help, what does someone without the resources that I had do? So our approach is to change the system of care by providing a lot of training and capacity building to healthcare providers serving new moms and their families, as well as an advocacy work to increase access to care. Thanks, Ray.
Great, thank you. Well, great. We're going to now walk through the bills. We wanted to start with a quick overview of the California laws. So Crystal's going to go back to the 2020 Mom webpage. We're on, just so you know, and you can find this page yourself later, we are on the 2018, so it's under advocacy, and then the 2018, California 2018 legislation tab. So we're going to start there. And we're going to start by talking about the bills that were signed into law last year. And I'm actually going to start by talking about the bill that's labeled AB 1893. So we want to talk about this bill. It didn't result in much outcome, and we'll explain why. But just to give a little bit of background on what that bill was, in case folks are curious, 1893 was a bill that called for the State Department of Public Health here in California, and I think several of you have worked closely on the line. I can see your names with the Department of Public Health and even are with county departments of public health. So this bill called for the California State Department of Public Health to apply for federal funding out of a bill called Bringing Postpartum Depressions Out of the Shadow Act. So that bill called for the availability of funds to states to work on solutions like telepsychiatry consultation programs, recognizing that at least one state in the nation had been able to overcome many of the barriers that we see, which result in the lack of screening and diagnosis of women who suffer from maternal mental health disorders. So that telepsychiatry consultation model actually out of the state of Massachusetts was listed up as a best practice, and the federal legislation really recognized that model and called for funding to be made available through a federal agency to state agencies who applied for that funding. So this bill in California called for our Department of Public Health to apply for that funding, to do something novel around improving access to screening and diagnosis. And unfortunately, the funding didn't come through to California. Several other states were selected who have other sort of broader infrastructure in place, it seemed. So that was put in place. Why that bill is important, though, is it does address the fact that multiple agencies can play a role, multiple state agencies can play a role and should play a role in addressing maternal mental health, just like multiple providers could and should play a role. So it doesn't fit nicely under any one agency, any one trade association like the Hospital Trade Association or ACOG, the American College of Obstetrics and Gynecology, for example. All of us must play a role. So that bill, again, was signed into law last year. And because that funding didn't become available to California, not much outcome to share with regard to that bill. Next, I want to turn it over to Kelly Kay, who's going to talk about AB 2193. This was the biggest of the three bills that were signed into the law last year and really touch on multiple stakeholder groups in taking a role. So Kelly, I'll turn that over to you, and Crystal will hover over that bill on the website.
Yeah, so AB 2193 was authored by Assemblymember Brian Manshine and co-sponsored by Maternal Mental Health Now and 2020 Moms. And it requires obstetric providers in the state of California to screen or to confirm that screening took place at least once during pregnancy and once during postpartum period. It also requires healthcare plans, including Medicaid, to create a maternal mental health program. The rationale behind that was because we know that, just mandating screening isn't all that effective, that obstetric providers need to have extra support to screen. So they need to know, many obstetricians are not screening because they don't know where to turn when they have a mild to severe case. So the second part of that bill, its intent was to provide them with that support by asking the healthcare providers to create a program available to them. It becomes effective next week, July 1st.
Very good. So this is, again, the bigger of the two bills that health insurers and health plans create programs to support screening providers and mothers who have screened positive, and also obstetric providers in particular to screen. You can see the language on the screen says at least once during pregnancy or the postpartum period. We're going to just comment on that briefly, is that the recommendation from the California Task Force on Maternal Mental Health Care is to screen at least once as well, and ideally more than once. We wanted to point out that Postpartum Support International, as a result of the task force that formed here in California created recommended screening protocol and for frequency of screening and also the timing of screening. So postpartum.net is their website. Again, we'll have these resources in the PowerPoint, including the links that we'll make sure you get after today's webinar. It does recommend those screening timeframes and frequencies. So again, at least once the law requires, and we'll talk a little bit more, I think, during Q&A. I think we'll hear some questions from all of you about what screening tools and things like that. There are some resources that we can point to later, and we'll go over that in Q&A. Thank you, Kelly, for going over AB 2193. I'm going to touch on the third bill that was signed into law this year, and then we're going to move into the bills that are the two bills that were introduced this year and the one that continues to go through the legislature right now. So AB 3032, you can see here on the screen. This I know that the hospitals that are on the line are familiar with. Hospital Maternal Mental Health is the name of the bill. And this one becomes effective in 2020, 1/1/2020. There really wasn't much rhyme or reason in the end to the effective dates of these bills. The legislature and authors kind of worked with various stakeholders on the effective dates. So 1/1/2020, hospitals have just a bit more time than the other groups do. Again, recognizing that multiple stakeholders really do need to play a role around maternal mental health to solve for all of the existing barriers. This bill requires hospitals to provide training to clinical staff who work with pregnant and postpartum women. And I'm going to pause there for just a moment and remind folks that it's critical that the training be comprehensive and be designed by those who are experts in the field. So those of you who've been through maternal mental health training know that there's a lot that you don't know until you go through training. And just want to point out the importance of hospitals utilizing staff who have been through comprehensive maternal mental health training and expert organizations like Maternal Mental Health Now and Postpartum Support International, who conduct provider training. We want to make sure that you all know the importance of creating your training programs in concert with those experts, that it's not something that just anyone, a trainer that you may have on staff, can easily put together and do well. We also know when it's not done well that it can cause more problems than good. So it really an important point. In addition to training staff, hospital staff, and we'll pause for just a minute on what we mean by staff or what the intent was with that term staff. So the bill technically, it requires hospitals to train their own staff. We think many hospitals will invite pediatricians and obstetricians who have admit rights into the hospital to join them for training, especially if they do one-day in-services and don't just rely on internal staff web-based training programs. So that's encouraged, of course, because we do want obstetricians and pediatricians to be trained. We will also talk about another bill going through the legislature now that hits on training for obstetricians in particular. So again, AB 3032, in addition to providing training for staff, that bill requires hospitals to provide information to mothers about the signs and symptoms of these disorders and any local treatment programs that may exist. So many hospitals, I think, will find that there aren't local treatment programs that you're aware of, even after a comprehensive review. We do think some hospitals who find that that's the case will end up creating programs so that there is something they can refer mothers to, even if they're not screening. And again, there's no mandate that hospitals screen. We do know many hospitals in the state are starting to look at screening programs, which is great, but not required. OBGYNs will say that because they're the ones that have to create the treatment programs, the treatment plans for mothers, because they are required to screen and diagnose, at least create an initial diagnosis, that some OBGYNs will actually say they prefer hospitals not to screen, but instead send mothers who are symptomatic or that they're concerned with back to the OBGYN. So something to think about. But again, the highlight for AB 3032 is that hospitals will provide training to their staff and also information about signs and symptoms of mothers and local treatment resources, if any. Great. So we're going to, I will quickly touch on ACR 180 that's here on the page. This was just a resolution declaring the month of May, again, Maternal Mental Health Awareness Month. We actually have another resolution in California that declared the month of May every year Maternal Mental Health Awareness Month, but this member of the Legislative Women's Caucus really felt like it was important to have time to read this resolution last year on the floor to help educate all of her colleagues, legislators, about the importance of maternal mental health before those bills went to a floor vote. So it was quite brilliant of her, even though initially we didn't think another awareness resolution declaring the month of May, Maternal Mental Health Awareness Month, was necessary. So we do also acknowledge Marie Waldron for her leadership in the Women's Caucus. So now we're going to go to the 2019 legislative advocacy page, Crystal. So you can go back up to advocacy. There we go. And you can see where Crystal's going. We're going to just talk, right there, 2019 California legislation. We're going to go through the two bills. We'll just touch briefly on one that did not pass out of a committee this year that will be reintroduced next year. And then we'll spend, that's AB 1676. Crystal has her cursor over this bill. I'll just quickly mention this, and then if folks have questions at the end of the call today, we're happy to answer questions about that bill too, again, knowing it will be reintroduced next year. This bill addressed the fact that OBGYNs, and let me just pause and back up just a minute. This bill was modeled after the Massachusetts model. We talked a little bit about telepsychiatry consultation earlier when we talked about those federal funds that were available to help states create telepsychiatry consultation models. Massachusetts, in addition to addressing telepsychiatry for mothers' mental health, first developed a telepsychiatry program for children's mental health, and it was created because of a school shooting, another tragedy long ago, actually, where a judge or court ordered the state to create a telepsychiatry consultation program for pediatricians, recognizing that there was then and still now is a shortage of child psychiatrists. Similarly, right, many of you know there's also a shortage of psychiatrists generally in the United States, and in California we have the highest number of shortage areas in the nation for psychiatrists and mental health providers. We also have a super shortage, we say, of those psychiatrists that are trained and willing to treat mothers. They often, a psychiatrist will often, as many of you know, refer a mother back to her OBGYN who has already sent her to go see a psychiatrist. And it does take special time and interest to become an expert and keep up with the latest literature around safety during pregnancy and lactation of medication, and also other treatment options that are safe and effective during pregnancy and the postpartum period. We call those psychiatrists reproductive psychiatrists. There isn't yet a formal clinical designation for reproductive psychiatrists, although we think that may be changing at some point down the road. There are training programs and fellowships that exist for psychiatrists who want to call themselves a reproductive psychiatrist. So that bill, AB 1676, called for the state through insurers, again, insurers and health plans, to make available a consultation program line for OBGYNs and for pediatricians. So for OBGYNs to treat mothers and pediatricians to treat children, and also general primary care providers who might be treating either population and mothers during pregnancy and the postpartum period specifically. So that bill did not get out of the Appropriations Committee this year, but will be reintroduced next year. And it was really on a technical issue around one of the reports that was missing at a particular research study on the cost effectiveness of such a program. Again, that bill will be reintroduced next year. We will now go to the other bill that continues to go through the legislature this year, and that is AB 845. It's up here on the top of the screen, and this requires the California Medical Board, that's the agency in California that licenses MDs, medical providers, requires them to create, makes it optional, but highly encourages them to create a training program for MDs in maternal mental health. A similar bill was passed several years ago for pediatricians and understanding child psychiatric disorders and how to screen, etc. And that medical board, even though it was optional, the bill was optional, the medical board did recognize then that the state legislature felt it was a priority and did prioritize development of that training program. So this bill has not been signed into law or passed, hasn't passed the full legislature yet, but we expect that it will be. So wanted to cover those two pieces of legislation as well, since we know that there have been some interest in those bills from the community. So we're going to, I think what we're going to do now is pause and see if there are any questions about these particular pieces of legislation. Crystal will look at the questions, so you can go ahead and use your control panel, go to webinar control panel to check on, to submit your questions. So we'll see if there are any. We'll have time here at the end after we go over resources and hear from today's sponsor, Momswell. Let's just see if there are any questions that are coming through, Crystal.
Not yet.
Okay, great. So we'll continue then to go through the resources to implement the two big bills, the hospital bill and the screening bill and insurer bill. So Crystal, if you could go back to the 2019 California legislation page, this is where you're going to see the handouts that we'll review. And we'll have Crystal, Crystal, the 2018 legislation page is what I meant to say. There we go. And you can scroll down. There are three resources that we'll pull up. So right here, we'll start with the pink one. So we wanted to start with this particular overview. This is the resource sheet for obstetric providers who are required now to screen. We also will just pause for a minute and say obstetric providers include nurse midwives and also obstetricians, OBGYNs, so obstetricians is that umbrella term. So anyone who's providing primary care for women surrounding pregnancy. We also have some family practice providers who are still considered obstetricians and providing that primary care and labor and delivery support. So you can see this is an overview of the bill here at the top. It talks about the screening questionnaires like the EPDS or the Edinburgh it's also called, or the PHQ-2 or 9 screening tools. It also talks about the requirements for health insurers or health plans. We want to scroll down now on this page, Crystal, and we'll show folks what resources currently exist. So right here, you can see Postpartum Support International has a frontline training program that's available for obstetricians and others. You can see the price there. You can see their website. They also have a warm line for of providers who've been vetted, so local treatment providers, mental health providers. So once a provider has a positive screen, for example, and an initial diagnosis, some resources can be obtained through that PSI warm line. They also are now starting to create an online resource directory of those same vetted providers. People have to opt into that directory, but it will be available, or is available now, on the postpartum.net website as well. They also have a complimentary reproductive psychiatry consultation program where a provider can request a future appointment with a psychiatrist who's trained in reproductive mental health. So it's not for providers, but for OBGYNs. Again, it's a volunteer program. They have volunteer reproductive psychiatrists that are staffing it. There may not be capacity if every single OBGYN were to book appointments, so the wait time might be quite long, but again, are nice free resources that exist right now. 2020 Mom, our website is here. Just want to point out that there's some resources that are available on our website, including a menu of evidence-based treatment options that came out of the maternal mental health task force that ran. I know a few of you on the line, Christine Morton and others, were involved in that work, and will be updated. Hasn't yet been updated, but will be updated routinely to make sure that it keeps up with any new evidence-based treatment options that may exist. And this is something that folks like to share with patients because it can help them create a treatment plan together that the mother is comfortable with. And it includes things like writing a prescription for exercise, right? Giving mom the permission to go exercise, saying that this is critically important to your recovery, for example. And the menu of treatment options also talks about which types of treatments are considered preventive. There's also a mother's support assessment tool that exists on 2020 Mom's website on that materials page. This is something that an OBGYN or screening provider can give to her patients or his patients to assess her support at home. So does she have practical support? Does she have friends, the friendship of other mothers who may be going through something similar? A nice tool to help look at, again, that important social support and practical support component. And then also an overview of all the validated screening tools exist on the 2020 Mom website. Maternal Mental Health Now is here too. Kelly, I'm happy to go over this, or I'd love to turn it over to you to talk about those three columns, the training, the toolkit, and case consultation that you provide.
Sure. Yeah, the first column details our online training program. We currently have one bundled course available through that program. It's 12 hours in length, 12 CEUs and CMEs are available. Some of these details are wrong, so we'll edit it. And the cost of that is $495. We are also able to, for institutions that may want to upload this program into their system, their own internal learning management system, we're able to provide you the content in a format that will allow you to do that. And we are currently working on pricing for that and should be announcing it in early July. We're also going to be rolling out 6 new individual online courses. They're just an hour or 2 in length each. And there'll be 1 to 2 CEUs and CMEs available for each one. One of those is how to screen. And it includes some role plays and examples of people conducting the screening in a hospital environment as well as an outpatient clinic environment. And that will be rolled out in July as well. We offer a free downloadable toolkit, which is sort of our, if you complete the online training, the Bringing Light to Motherhood online training, you get the toolkit through that too. But it's 60-something pages in length and includes everything about perinatal mood and anxiety disorders from signs and symptoms, risk factors, treatment options, screening tools, and there are some resources in Spanish available through that toolkit as well. And then once you've been through our trainings, whether it's our online training or we also offer in-person trainings, largely in Los Angeles, we are welcome to attend our monthly case consultation groups. Those are held on the first Wednesday of each month through a GoToMeeting platform similar to this one. It includes about 20 minutes of a clinician doing a little bit of training focusing on a different theme each month. And then what follows is it's an opportunity for people in the community who are doing screenings, who are doing treatment, to bring their more difficult cases to the table and discuss them and troubleshoot them together. And that's offered as a free service.
Great, thank you. We're going to now, Crystal, go to, we've got one question, but we'll wait and answer those questions in just a moment. We're going to go to the next document on our website. We have a resource list for hospitals as well here, and also a resource list for providers. I'm sorry, for mothers. Okay, and I have lost my screen suddenly, but I'm going to go ahead and pull that up directly on our website, Crystal. And can you tell me which one you're showing right now?
Yes, I'm going through the AB 3032 Hospital Maternal Mental Health Training Resources.
Thank you. Good, so I have that up now, and you can see that top section, again, is an overview of the law. We already went over that, but this is nice for all of you that work in a hospital setting to be reminded of what the requirements are. Again, we have this first section is the training resources. We actually already went over the training resources just a moment ago. What we didn't share around the postpartum support international resource, though, is that in addition on the obstetric provider screening tool, or overview sheet, rather, we talked about their frontline provider training. PSI, actually in consultation or in partnership, rather, with 2020 Mom, also offers a maternal mental health 101 training that's complimentary. It's 2 hours and no CEUs. There's no certificate of attendance that's provided, but again, a potential resource for hospitals if you can find a way to track whether your employees are actually going through that training. There also is a more comprehensive certificate-based training that PSI and 2020 Mom offer. You can see that on the far right here. Again, 8 hours, does include CME, CEUs, and also a certificate of attendance. PSI also has in-person trainings, customizable, that they are able to do for hospitals, so in person. You can see that. Maternal Mental Health Now, again, the information Kelly already went over, their online self-paced web-based training program. You can see CEUs are provided. There are 12 hours worth, and we talk about the segments that would meet the legislative requirements here. You don't have to take all 12. And then there's also the customizable in-person training that Maternal Mental Health Now offers, and really a great resource for California-based hospitals. If we scroll down, we wanted to share for hospitals, again, the resources around patient education. So you can see 2020 Mom offers RAT cards that can be downloaded for free. Our partners also offer various downloadable resources, including Maternal Mental Health Now. Kelly, I'm just realizing we should update this page to make sure that your free resources are listed as well that can be downloaded for hospitals to distribute. 2020 Mom does also offer customization. So some hospitals already ask for those RAT cards that provide symptoms and such, but then hospitals want to publicize their support group, for example, that may exist for mothers who are distressed, and that can be, those RAT cards can be customized for a small fee using our graphic designer, so that you don't have to design those separately and branded with your logo. Postpartum Support International also has a video that's available for patient viewing. So if you prefer to show videos and have the capability of doing that while mom is inpatient, that's also a great option. We're going to also say, if any of you are aware of other resources that we should be listing here, we'd love for you to share those resources with us. We'll vet them and decide whether or not we should be including them on these resource sheets. and we'll be sharing them again through our e-newsletter, all these resource sheets later this week or early next week. So if you do have more resources you'd like to share, please send them to us, either Joy or Crystal at 2020mom.org. And the last resource sheet that we'll go over before we stop for Q&A and hear from our sponsor today is the resource for mothers. We do know that there are some of you on the line that are mothers and want to support mothers in your community. And many people have asked, well, what happens if my OBGYN, for example, doesn't screen a mother or me, or what happens if my hospital doesn't give me anything, come 1/1/2020. And so this page, this overview of laws for moms and families, goes into some of those resources for moms to report concerns about non-compliance with the laws. So the first page, as you can see, is an overview of the two laws. And we also, and I'm sorry, it's just a one-page document, but also on this page, we list the website links for mothers or family members or consumers to file complaints, both with you can see the first link under AB 3032. You can see that first link it's to CDPH, the California Department of Public Health, licenses hospitals, and they have a file a complaint form on their website for consumers to file a complaint with their hospital. We also encourage mothers, though, to file a complaint with the hospital directly or family members. Don't be shy about doing that. Of course, we know that there's so much going on surrounding labor and delivery, and it's the last thing that you all might be able to, or mothers might be able to think about, but do want to share that that's a pathway as well. Under AB 2193, you can see that there are three links here. One is for the medical board at the top there, nbc.ca.gov. That's the medical board to file complaints. Again, this is how the licensing agency for those providers can track whether there are problems with providers complying with the law. And then also with the health insurers, you can see those two links for the Department of Managed Healthcare that primarily regulates HMOs, although some PPOs, and then there's also the Department of Insurance who regulates most PPOs in the state. Crystal, I will now turn it over to you for questions. I know one question that came in kind of addressed, like, what do I do if I'm a provider and I need to find an in-network provider for my patient, and I can't seem to find one who's qualified. So Crystal, we'll turn it over to you to help answer that question and address any other questions that came in, and then we're going to turn it over to our sponsor, Momswell.
Sounds great, absolutely. So we've got a couple people with hands raised. So I will go down the list here and just unmute and call your name if you'd like to ask a question. To address the question that you just brought up, Joy, the question was sent in from someone who works in obstetrics and screens for perinatal mood and anxiety disorders and wants to know about receiving a positive screen, what steps should be taken. So you should definitely contact the insurer for an in-network trained provider. And if they're not able to provide one for you, you can contact the Department of Managed Healthcare, and their help center can help you get that addressed and find a provider for you.
And, you know, I'm going to pause, Crystal, before we unmute the lines of folks that want to ask a live question. You can also put your question through the questions feature in the chat, or I'm sorry, in the GoToWebinar control panel. But before we do that, I'd like to actually turn it over to Momswell. And Crystal, if you can pull up the momswell.org website for us, I'd like to give an opportunity to both Maureen and Melissa, who can briefly introduce themselves, to say hello and talk about the Momswell solution that exists as well. And thank you again for sponsoring today's webinar, Maureen and Melissa.
Hi, everybody. We're so excited to be here. It's an honor and a privilege to be a sponsor of this really important webinar. We are so impressed with the work that Maternal Mental Health Now and 2020 Mom has done to get this legislation passed. And to those providers who are wondering where to send moms who screen at risk, moms, we got you. We created Momswell just for you. We created Momswell with the role of helping the provider to find maternal mental health complications. We wanted to help them screen and assess women and put this at your fingertips. So we know that providers don't have time and they don't know where to send their patients. We know we don't know about the quality of screen, of like where she's going, if she got the right care. We know a lot of times providers don't know what the right thing to say is if a mom does screen at risk. And we know that a lot of providers don't know who to call if she does need immediate care right on the spot. We also know that providers don't necessarily know if they can get reimbursed for that screen or what codes to use. And that's why we created Momswell. I was a mother who was pregnant in Monterey 10 years ago, and I slipped through the cracks in such major ways multiple times. So Momswell is the digital tool that could have helped me. This is created from everything we've heard from providers and patients about what could have helped them. So what we do is we streamline the screening and referring process for not only OBGYNs and pediatricians, but also for labor and delivery hospitals. We handle everything from screening and scoring to reporting, referring, and patient education. Momswell is HIPAA compliant. It comes in English and Spanish. Providers have the chance or the choice of using the EPDS screening tool or the PHQ-9. This is how it works. Moms initiate the screens on their phones while they're waiting to be seen by the provider that day. And the results get back immediately to that provider. There are step-by-step prompts that guide the provider to make better treatment plans. And at every step, providers get recommended scripts to help them find the right words to say. We know that it's tough if a woman just said she has thoughts of self-harm. We give you the right words to say to acknowledge the courage that it took to be honest. We also offer our providers extra information, little pop-ups within the system so that if they want to learn a little bit more about the maternal mental health spectrum, they can look really fast on that, or what some of the treatment options are, or how they should assess risk to the mother and the baby if there were thoughts of self-harm. With Momswell, every mom who screens at risk receives multiple local, national, and online referrals that she can access from her phone or any device at any time. So no more papers getting lost. This is all on her phone or on her email. She can also get tips on how to access care. So what Crystal was saying, I know I had never had a mental health crisis in my life, so I didn't know that I was supposed to call my insurance and use special words and ask for a therapist. I didn't know that there were free online support groups that I could go to. So we give moms a little step-by-step, this is how you can access the care. We also offer self-help tips, which is really important. Stuff like, be kind to yourself and drink some water and get some sunlight. We have a number of tips for her. The one thing we're really proud that we offer is that every at-risk mom can opt in for free Momswell peer support. This peer support specialist will help link your patient to local support. So it means not just sending mom to the PSI number, it means we'll get back to her within 24 hours to see if somebody did get back to her. And if they haven't, then we're gonna make sure we find somebody who does. We also, if the provider, in the case of self-harm, so if a mom says she's having thoughts of self-harm, we connect that provider with a brief risk assessment, a suicide risk assessment, and we connect them to the National Suicide Prevention Lifeline so that they can consult with that lifeline with their patient in the exam room and decide if that patient needs immediate care. And if the patient does need immediate care, we've loaded in the best local number to call. to call to get her into the right spot, so that you're not searching and you need to know this stuff. We've already done it all for you. And if the provider would like to prescribe any psychotropic medication, we give you that PSI, frontline provider consult number, so that if it makes more sense for you to prescribe to her, we give you that option. I'll put everything right in the palm of your hand. We also let providers, you can override a negative screen at any time, so that if you feel she needs extra resources, you can connect her right there and then, and she'll get all of the referrals. We also give out comprehensive reports, though, that makes it easier to document and to get reimbursed, and they're easily attached to the patient's electronic medical record. We are really proud of what we created, and we also know that we have to incentivize our providers to be taking these extra steps. We know it takes time, and so we've been collecting the billable codes to make it really easy for you guys to know if you get reimbursed, what the codes are, how you submit them, and with our documentation, it's pretty straightforward. And in honor of this amazing legislation that 2020 Mom and Maternal Mental Health Now has worked on, we created a compliance coupon for California providers that gives them 50% off a year of unlimited maternal mental health screens. But for this special webinar group, we're going to create an even deeper discount. We're going to give another $20 off, and the coupon code that we're going to offer everybody is CAMMH, and with that, it would make the subscription $380 for a year of unlimited maternal mental health screens, and it's 100% tax write-off because it's a compliance tool that helps your business. So we just really wanted to close this gap with providers and patients by using technology and making this just a full system of care. Thank you.
Maureen, I know it's safe to say that those on the line that are screening providers in particular are very grateful for this new resource that you've created, and thank you for that discount code. We will send it out again with the slides and the recording from today's webinar, that discount code, so that you can share it with your network if you're interested. Thank you again to Momswell for today's webinar. We're going to stay on the line. We know some of you have to go. Feel free to stay on and go through questions with us. We appreciate the flexibility. You know, we got a late start here. So I have seen another question come in. We wanted to share a question that came in from someone who works in a hospital setting. She's asking if, number one, how does the legislation define clinician? And that's an interesting question, because there probably is a statutory definition of clinician. What we recall that definition being is really any provider who's licensed in the state. So that would include providers like licensed clinical social workers. It would include therapists. It would include RNs who work in a hospital setting. I hope that covers it. MDs who are on staff, or contracted, right, by the hospital, like hospitalists would be considered clinicians. Hopefully that helps. I don't know if you have a specific question, feel free to, is XYZ considered a clinician, and we'll try to address that. Again, really anyone who's licensed to practice as a clinician in the state is the definition we would lean on. We also got a question from a hospital who is asking if there's an outpatient kind of clinic setting, or even a sort of a birth center that's attached to a hospital, if there's an obligation. And really the intent of that law was to require those who provide birth services, so essentially those who are involved in labor and delivery, to comply with this legislation. It doesn't mean that hospitals who don't have a labor and delivery unit shouldn't consider doing this, but there's no regulatory obligation. So we know a lot of women, for example, will show up in an ER setting after potential suicide concern, or having a panic attack in the perinatal period and thinking they're having a heart attack. And of course, we feel it's important that ER providers be trained and offer that support, even if there's no labor and delivery unit. That's not a requirement of the law, but just to give an example of, one way that hospitals who don't have an L&D unit can support these mothers. So hopefully that answers your question. Feel free to use that question feature and ask it again, or another question if you need to. Crystal, are there any other questions that came into the GoToWebinar questions box before we open up lines for questions?
Not as yet. Oh, wait.
Okay, great. And Crystal, I think it's fine to go ahead and open up phone lines. We'll unmute those of you who have raised your hand. If you still have a question, we're happy to unmute your line. Crystal, you can go ahead and do that directly to the center.
I'll go ahead and get started with Linda Griffith. And Linda, I've unmuted you. Are you able to hear me?
Okay, great. She may have had to drop, so why don't we move on to the next one, Crystal?
Okay, I've got Susan Fanta. Hi, Susan, can you hear us?
I can't talk.
Oh,
I put the question in the box.
Okay, well, we might have already answered it. And why don't we go ahead and take that route? We'll go ahead and ask if anyone has any remaining questions to use the question feature of your GoToWebinar and just type that question in. And Crystal, let's just take another look at that question box and see if there are any other unanswered questions. Have you seen any other unanswered questions, Crystal?
I've got one here, okay, that just came in. So for the bill regarding clinical consultation, is it dependent on the patient's insurance?
Yeah, and that's the bill that did not pass. So it will be reintroduced next year. So there is no state mandate for obstetricians and others to be able to call in for access to a reproductive psychiatrist. So I think we'll leave it at that at this point. But the Postpartum Support International resource that exists is available regardless of insurance. It's completely free to providers, and Momswell also links to that resource, the Momswell resource that Maureen covered. So I think we'll leave it at that. If you have any other questions and want to follow the bill that gets reintroduced next year, you're welcome to email any of us on the phone line today. Any other questions, Crystal?
We did. We have one more come in. So is there legislation to fund training for psychiatrists or psychiatric mental health nurse practitioners?
So the training that we mentioned that's part of the pending legislation that's going through the legislature today, right now, which I'm just going to remind you is on the website under 2019, under advocacy and 2019 California legislation, excuse me, that bill number, AB 845, that training will be made available through the California Medical Board, so to any provider, including psychiatrists. We know that there are psychiatric nurse practitioners who won't necessarily, my understanding is they won't be able to access that training. And so our recommendation is that they go through training offered through an organization like Maternal Mental Health Now, Postpartum Support International, or even that program that we mentioned earlier that's offered by both 2020 Mom and Postpartum Support International. So there's no legislation that's requiring anyone to get trained, but there are training resources that are available, and of course, highly regarded as critically important for OBGYNs and others to be trained. There is, I will comment on some trade associations, including the American College of Obstetrics and Gynecology, as well as the board that certifies OBGYNs, ABOG, are making training a requirement for recertification. So it's called maintenance of certification. So there are things that are happening, which is why it didn't feel like the right thing to do to require a mandated training at this point, because there are lots of resources and trade associations who are starting to require training and make sure that the training is well vetted, if that makes sense. But if you do have questions or concerns, comments, and want to continue the dialogue on that front, feel free to email any of us, joy@2020mom.org, crystal@2020mom.org, Kelly at maternalmentalhealthnow.org. Crystal, any other questions?
Yeah, there's two more. Just the follow-up to that was asking about training funding for postgraduate training to become an MD in psychiatry or a PMHNP. So
I would love for you to email us that question. There is some really good work that's happening with one of our other sister nonprofits called the Marseille Society. They're really working on their researchers, and primarily, it's not limited to researchers that are psychiatrists, but many of them are psychiatrists, and they have kind of taken the lead on working with the various, I think there's 2 certifying bodies, and working on fellowships, etc. So the Marseille Society is a good organization for you to check out, the Marseille Society of North America. But go ahead and shoot that email off to me, 2020mom.org, joy@2020mom.org. And this is also addressed in the white paper. Crystal, if you can just go to 2020mom.org, the homepage. I want to make sure folks know that there's a white paper that was produced to show California's strategic plan for addressing maternal mental health, again, formed at the urging of the legislature, this multi-stakeholder body, and together that stakeholder group created a strategic plan for the state. And this is one of the areas that was addressed, sort of the lack of psychiatric training and what we need to do around maternal mental health. So if you go up, Crystal, to the top of that page, there is a thumbnail. I would just go to the homepage, Crystal, if you just go to 2020mom.org and take out the search for white paper, it will show up. There's a thumbnail on the top right of the homepage. So 2020mom.org. You can click right there on 2020mom, the logo, Crystal.
Have I missed it?
Yeah, it's on 2020mom.org, the homepage, and then the thumbnail is right there on the top of the page. Oh, you're in our blog, but you can click right there, Crystal. Click on white paper. That'll take them there too, but you had the search criteria up. So anyway, you're welcome to take a look at that strategic plan. There we go. That's the page that'll take folks to, and there's a full report, executive summary, etc. And there is some acknowledgement around the need for additional reproductive psychiatrists. So thank you for that question, and what type of training and support to get, what kind of funding might exist to get people trained in reproductive psychiatry. Do send us an email after you take a look at the white paper and check out the Marseille Society of North America. Check out their webpage and see what you can find there, and we'll share some more information with you later. Great. Well, I know we're quite a bit over time. We really appreciate everybody joining us today, and we are going to include the recording on the website, and also to everyone who's registered, they'll get a copy of the recording and the PowerPoint deck and each of these 3 resource sheets today, as well as a link to Momswell and the code that Maureen shared, which is, Maureen, I'm going to have you repeat it one more time. It's CAMMH.
Yes, that is correct. It is CAMMH.
That's great. Thank you. We'll make sure we put that in writing to all of you. Again, to subscribe if you're interested in the screening providers and offices, to subscribe to the Momswell service for 1 year at that deep discount. Maureen and Melissa and the Momswell team, we thank you again for your sponsorship of today's webinar, and we thank all of you for joining us. Kelly Kay, as always, thank you to Maternal Mental Health Now for the leadership that you have put into all of the work in California. We are grateful for you and all the resources and support. Thank you, everybody.